everyone. Thank you for stopping by my channel. Today's video is about finding high-paying jobs where you can work from anywhere. If you stick around, I can give you a few tips. If you have a background in customer service or member services or provider relations, whether you're a nurse, rehab specialist, or therapist. Let's see, we got social workers and also case managers. These roles are generally found in hospital services or any other clinical services such as ambulatory centers, skilled nurse facilities. You can take your experience in these clinical settings and transition to a non-clinical role. And you say, what is a non-clinical role? Insurance companies, they're mostly referred to as HMOs. They will utilize your skill set to help them to provide services to their members. Most of us, or the majority of us, have insurance companies that we have a health benefit basically. And whether it's commercial or whether it's state-driven benefit, these companies require assistance from clinical or clinicians who will assist them in providing services for their members. First thing you need to do as a nurse, if you're a nurse, you must use your you must use your licensure, whether you're an LPN or an RN. It is required that you be licensed in the state that you're providing the service to. You can utilize your clinical background. Many of us have various histories in med-surg, skilled nurse facilities, hospice, home health, you name it. You can take that experience and it translates or transfers into providing your using your nursing judgment to assist these providers in executing their requests for services. A lot of the requests that you receive as a utilization management personnel, you will receive requests from providers to, let's just say if a member requires oxygen, and that's a DME company that has a prescription that requires this member to have 3 liters of oxygen. Well, as a nurse at this utilization company, this utilization review department, you review the script that the provider has sent over, and you're reviewing clinical notes to determine whether it meets medical necessity. As customer service, you're providing the members, could be me, could be you, providing information that the member may have, like what is my member number, what is my ID number. There are a host of roles. Case management. A lot of our members are pediatric patients and they require management of their care by the insurance company, and the case managers assist providers in providing the care that the member needs. Also, as a social worker, they're utilizing their skill set to help manage the members' needs. So there are a variety of roles, and these positions pay really well, and you work from home. I have currently been working from home for 14 years for the HMO that I work for, and I loved it, and I still love it. So if you find yourself at a crossroads, I'm sure many of you are looking at the news today and you see there are so many nurses on strike. There are so many news articles where the burnout is extreme. The nurse to patient ratio is ridiculous and people are just cracking under the pressure, and the nurses have had enough. Well, not only the nurses, but the personnel, everyone that's involved in the care of a patient has had enough. So if you're looking for other avenues where you can utilize your clinical experience, your clinical licensure, and your background, take a look at utilization review. Do a little research, go out onto the usual Google, do your Googles, you know you need to do your Googles, but check out Look at some of these roles that are out there. You'll be surprised at the amount of money and the ease and the work balance that you are looking for. It's out there. If you just do the research for it, it's there. So let's see if I got some other tips. Have some basic knowledge of billing and coding. Some of us may not have that skill set, but those of you that are nurses, billers, or coders, you know a little bit about, especially if you worked in the doctor's office, you know a little bit about everything that you do. Every service that a provider has performed requires, it has to be billed. The office visit has to be billed. So do a little research and find out what can I do to gain a little knowledge so that I can speak knowledgeably during an interview. Let's see, what else can we utilize? I got a couple of notes, so hold on. As a nurse, if you have knowledge of Milliman or Interqual guidelines, these are the guidelines that a nurse uses when you receive a request from a provider. Say if we got an arthroscopy of the knee that needs to be performed, the doctor's requesting a surgery. So we're going to need all of that clinical information, and we're going to look at that clinical information and determine if the guidelines with the request that the provider is requesting and the notes, if it meets medical necessity based on those guidelines. Everything we have to do these days, we have to research, and we have to get ourselves up to par so that we're able to speak knowledgeably during these reviews. It's worth it. The money is worth it. The work-life balance is worth it. And also just being able to work from anywhere in the States. I supported a plan clear across the country on the East Coast, and I live on the West Coast. So you can work from anywhere. Just utilize all of the things and the tools that you have in your tool chest, basically, i.e. your background, to secure a good paying job where you can work from home. Comment below if you are currently already working in utilization review, or you have other questions that you want me to answer. I would love to see the majority of our nurses and our clinicians get to a better work-life balance, because it's really scary out there, people. It really is. And if you're like me, I desire to work from home. I enjoy what I do. And I pray that most of you will join me also in the management organization. Talk to you soon.